Okay, ready on your end?
Sure.
Okay. Dr. James Greenblatt, welcome back to Shrink Wrap Radio.
Thank you. Pleasure to be here.
Well, I'm pleased to have you on the show again. We spoke 2 years ago on Shrink Wrap Radio number 406 about listening to your gut. And as I recall, I found you as a result of an internet search because I had heard of something called a fecal implant, which sounded pretty bizarre at the time, and I wanted to find out more about it. And you did a good job of cleaning up the mystery, no pun intended.
Right.
I don't think I realized at the time that you are an integrative psychiatrist. And so maybe you can tell us what that implies.
Sure. I've been a traditionally trained psychiatrist practicing for 26 years. And I like the term integrative as I look at all possible interventions that might be helpful to our patients. So I prescribe medicines when indicated, but also look at kind of nutrition, metabolic, and the topic we talked about earlier is how the GI tract might affect brain function and all aspects of the physiology that might impair mental health.
Yeah, and I think that will become very clear as we talk about your book, because you've brought out the second edition of your book, Breakthrough. Let me get it, the complete title here: Breakthrough Depression Solution. That's it. So I'm wondering what new developments spurred you to bring out a second edition of your earlier book.
Well, I think that the field of integrative psychiatry has really captured the attention of both the lay press and our academic community. So the research is exploding. And one of the chapters we added was on kind of probiotics and how the gut affects the brain. And the research on some of the vitamins and minerals have also exploded in how it affects depression. And I wanted to make sure that we had up-to-date literature supporting this work.
Yeah, that's very exciting work. And as I went through the book, it's truly a very comprehensive book that I could imagine would be of value not only to lay people who are struggling with depression or related sorts of issues, but also even to professionals. Did you have both audiences in mind as you were working on this?
Absolutely. In this world of integrative medicine, as you know, many of our patients sometimes know more about nutrition than our physicians.
Yeah.
There's no nutritional training in medical school.
Yeah, that cuts both ways because now, as a patient, sometimes the physicians, and we can talk about this a little bit more maybe as we get into this, sometimes the physicians are reluctant to commit themselves. And they say, well, look, here's the array of options, and you tell me what you want to do. And so it's like the pendulum has swung, but maybe too far.
Exactly. No, when I used to talk 10 or 15 years ago, it was quite clear that many physicians were taking supplements themselves, things that they've read, but they didn't feel comfortable prescribing to their patients because they didn't kind of feel like the research was sufficient. I think the research has caught up, but it's very hard for physicians to get the training to know what to do and how to use integrative psychiatry in their practice.
Yeah. Well, let me lead you through some of the topics and questions that you raise in your book. And for example, you have a section on personalized medicine. My experience these days with the medical system is that it is anything but personalized. So tell us what you're getting at.
I think that's the core message of the book and the work that we do is that psychiatry now, particularly psychopharm, is just treating symptoms. So everybody gets the same antidepressant. And the point of integrative psychiatry is look for underlying cause. And that's the personalized medicine approach. So 10 individuals that have depression, there might be different causes. Someone could be a B12 deficiency. Someone else could be a trauma in their past. Someone else might have celiac disease. And malabsorption of nutrients over many years. And that's where we try to use the term personalized medicine.
Yeah, okay. And but I wonder if insurance reimburses for some of the alternative parts of your approach. You know, for example, supplementation and
Well,
and
the insurance, as a physician, ordering a B12 level, checking iron, vitamin D, those are routinely part of they should be routinely part of a medical exam, and insurance covers that. There are some other tests that we look at, kind of measuring bacteria in the gut or amino acids that aren't covered by insurance. The supplements that we recommend are not always covered by insurance, but many patients have medical savings plans to for insurance.
okay. Now, early in the book, you raised the question, what is depression? Don't we all pretty much know what depression is, or are you getting at something different?
I think we all kind of understand what depression might feel like. I think some of the confusion or controversy is understanding depression as an illness, as a kind of changes in physiology that affects the brain that can be treated, and drugs are not the only answer.
Yeah. So everybody has periods during which they feel blue. How do we evaluate depression? How do you evaluate depression as an integrative psychiatrist?
It's a great question. I think the difference between the sadness and feeling blue once in a while is different than what sometimes I refer to as almost a numb feeling. It's beyond sadness, and that black hole where there's an indifference to hobbies and projects, changes in appetite, fatigue, sleep, and thoughts of death. It's a very different dimension, and it persists. It persists for weeks and months. So those are the list of symptoms. But as we'll talk about, those symptoms could be due to a thyroid deficiency or a B12 deficiency. And my job has become more like a detective to help sort out what might be some of the underlying contributing factors, and not excluding the psychological and or stress in someone's life.
Yeah, that's what I like about your book and your approach is it is balanced in terms of it's not a black and white thing of it's all nutritional and the brain and so on to the exclusion of psychotherapy. But in fact, it's an integrative approach, right, in which you leave open possibilities for a broader spectrum of interventions.
Right. And that's the frustration I have in the field as people have gone to extremes, either just medications, just psychotherapy, or just vitamins. And it's harder for many of my colleagues to understand we need to use all of our tools to support patients struggling with depression.
Yeah, as a matter of fact, I think it was the interview just before this one that I did was with a Dr. Peter Kinderman at the University of Liverpool, and I think he's about to become president of the British Psychological Society, and we were discussing the debate about the disease model when it comes to problems in living, if you will, and and so that you would have thought that was resolved some time back, but it's
Right.
still it's still a debate, and it seems to me that you're on neither extreme of that debate, but really trying to kind of play it right in the middle to look at the organic difficulties as well as the purely psychological, psychosocial roots.
Exactly.
Um, Going back to personalized medicine, in that context, you say something about the role of genetics and epigenetics. What can you tell us about that?
Well, I think the longer I practice, it's harder to not appreciate the role that genetics plays in the onset of depression as well as the severity of the disorder. So, a family history is an important part of the evaluation. It's not always parents; it could be relatives, aunts, uncles, nieces, nephews, grandparents. So there is a genetic liability, but the line that I use all the time is genetics kind of it's a liability, but it's not our destiny.
Mm-hmm.
And epigenetics are all those factors in our environment that control the expression of certain genes. And those epigenetic kind of concepts could be psychosocial, could be stress. And the work that I look at mostly is nutrition, nutritional deficiencies. So we look at deficiencies of vitamins and vitamin D and zinc and lithium. These are all nutrients that affect the expression of certain genes and can either hinder or support treatment.
That's really fascinating, and a good deal of your book is taken up with that, and you use an acronym called ZEBRA, the Zebra approach, which accounts for a lot of chapters. Maybe you can. I know there's not going to be time to go into the depth that you do in the book, but take us through that acronym and give us the highlights, if you will.
Sure. I was trying to think of a way to, both for clinicians and for patients, to remember all the factors that could be contributing to the depression. And when I started 25 years ago, I wouldn't look at the big picture. I would pick and choose. But now I'm finding that so we don't miss anything. And the zebra approach is the kind of the acronym for um, T for is take care of yourself, and that describes stress, too much sugar, and the importance of sleep. H is for hormones. E is for exercise. And then zebra with two E's, zinc and the trace mineral. Exclude is looking at celiac disease and other food allergies. The E is for the essential fatty acids, the importance of omega-3 and omega-6 essential fatty acids. And then the B vitamins and the other vitamins, vitamin D. R is for restore, that's the gut, and A is for amino acids. So we need to kind of cover that zebra approach to be able to best understand what may be contributing. And there could be two or three kind of deficiencies that might be contributing to an individual's depression.
You know, as we go along, if there are any case histories that come to mind or examples that you could give of difficult cases that you've dealt with, that would help us to make it more concrete and also to expand into the available time. You just kind of went through the heart of the book there very briefly, and I don't have a lot of sub-questions at this point. What are some parts of that zebra that you just took us through that maybe you'd like to dig into a little bit here?
Sure. Well, I think I'll start with a case. A gentleman I saw in follow-up last week who presented with severe anxiety and depression. He's a 27-year-old male who was diagnosed with celiac disease. So he was on a gluten-free diet.
Tell us about celiac disease.
Celiac disease is a disorder. It's called an autoimmune disorder of the gluten from wheat products, and people develop many symptoms. But what happens is the body's immune system destroys the intestine, so you don't absorb nutrients, and many patients get GI distress. What we found, what we talk about in the book, is there are patients that only have psychological problems from celiac disease, depression and anxiety being the most common. So this gentleman was treated for celiac disease, which means he was on a gluten-free diet, and his GI symptoms improved. But his psychiatric symptoms, which included anxiety, depression, and severe self-injury with head banging and other forms of self-injury, did not disappear, mood swings. And when we did the nutritional testing, what we found is profound deficiencies in multiple nutrients, including zinc, vitamin B12, and vitamin D. And until those nutrients were repleted at fairly high dosages, there wasn't a resolution of his mood disorder. He was not treated with any medications, only these nutrients. And the deficiencies were caused by the celiac disease, but you needed to enhance his nutritional supplements for him to get any improvement. And I've seen him for now almost a year, and with a complete resolution of these psychiatric symptoms associated with this malnutrition.
Wow. So for him, the whole thing was really about malnutrition.
Related with the cause of celiac.
Yeah.
Other times we find malnutrition related to diet. A vegan diet for some does not provide adequate B12 or zinc, and that can be a risk factor. Oftentimes not getting enough amino acids, the building blocks of the neurotransmitters in the brain. And so dietary supplement can be really important in that respect as well.
Okay. So now in the supermarket, more and more stuff is gluten free, and it feels like we're in the midst of a gluten bubble. Does that seem to be the case for you, or I mean, is it as big as people make it seem, as widespread, or is there a little bit of hysteria going on, or what?
I believe there's a gluten mania and maybe a little bit of hysteria because I've been writing about for many years that gluten for some individuals contributes to psychiatric problems. We've seen it everything from psychosis to depression to fatigue.
Wow.
I do find that's real, and we can test for it and we can treat it. I do think now there's a little overhype and a little mania around being gluten free, curing every problem around, and it's less likely to.
Yeah, one of the things I was struck by is that your approach, you really do take a individualized approach by doing very thorough testing, so that instead of one size fits all, you're looking at where are the deficiencies and then addressing those deficiencies. And the other thing that jumped out at me is it's possible that a person might be taking supplementation, vitamins, etc., but that we absorb them differently. And so we may not be absorbing them, or we may be thinking that we're getting a certain dosage, but in fact we're not getting as much of it as we need, and so on. Say something about that, if you would.
No, that's really important, and that's usually how I start off all my seminars and talks about, because many of the patients coming to see me have been eating the perfect diet, spending the money on the organic health food, and struggling with depression and or fatigue. And when we look at their tests, we see that they're profoundly malnourished, and because they're not absorbing the nutrients and the healthy food that they're eating. So a major part of our assessment is the functioning of the digestive system, and oftentimes we'll need to use digestive enzymes to help individuals digest and absorb the nutrients, the food that they're eating.
Yeah, that's fascinating. And it makes me kind of want to go through that sort of testing battery myself. Not that I'm depressed at the moment, but who knows what might be lurking.
I think, as we uncover genetic differences, as we kind of age, or as we recover from illnesses, there are physiological consequences, and really testing is the only way. Vitamin D is in the news a lot, and our primary care doctors are now testing for vitamin D because deficiency is very common. But it's very hard to tell if someone's deficient by looking at them. The only way you would know is by doing a blood test. And vitamin D is one of the other nutrients associated with depression in some individuals. So testing is critical to make this kind of personalized assessment.
Mm-hmm. This makes me think, you mentioned aging, and then that made me think about melatonin. And I don't remember if melatonin is something that you specifically address. I used to take maybe 6 milligrams of melatonin, and I heard first of all, I heard that our natural production of endogenous production of melatonin goes down as we age, and that it's important in the regulation of sleep and so on. And so that's what got me started taking it. And then I happened to mention in in a lecture that I attended, a brain-related neuroscience thing where the presenter was going through some of these things, and I shared that I'd been taking 6 milligrams, and he thought that was too much and cautioned me to go down to something like 3 milligrams. And then I sort of stopped taking it. Something else I read made me think, well, maybe this isn't such a good idea. And I guess I'm typical of the population at large of getting sort of whipsawed back and forth between things that we hear and jumping on board this and then jumping off and jumping on to something else. Uh, Talk to us a little bit about melatonin, and particularly in older people such as myself, as well as the general population.
Sure. I think you bring up another good point in terms of the information. We tend to get so much of our nutrition information from the lay press, and it changes based on one article or one scientific paper. And we've been through it with many nutrients. It's good, then it's bad, and then it's good again. And I just think part of the solution is understanding that everyone's different. And
Yep.
that's that individualized approach. And two, is we need better research to assess, and it's hard to assess something like nutrition because of the tremendous range of individuality. Melatonin. My only caution is young kids. I think for adults taking melatonin is fine. It's been very helpful. Oftentimes, I recommend zinc because zinc is one of the nutrients that's needed to make melatonin, and zinc is often deficient as we get older. Melatonin, my recommendation is the lowest dose that works. So for many individuals, the early studies were on, zero point 0.5 milligrams, and that helped induce. So the lowest dose that worked, more is not always better. So some individuals are going to do okay on 3 milligrams. Some might need 6 milligrams, and I think that as we age, that dose is probably fine.
Okay. What else would you like to dive into in terms of what you see and yeah.
I think one of the things that we're also struggling with as a field in psychiatry are the kind of the use of medications and the side effect profile of medications. And then some of the work that we've done is looking at how to stop the medications, because can be a tremendous withdrawal effect from someone stopping antidepressant medications.
Yes,
And that's one of
there's
the areas.
somebody in my family actually who has gone through a horrible time with that of terminating a psychiatric medication too quickly. Just
Yes.
decided to go cold turkey, and then really suffered high anxiety, confusion, etc. Jumped onto another one, jumped off of that because they felt unsettled and so on. And it seems like there is a big issue there that's not adequately spoken about.
Yes, and um, you know, traditional psychiatrists were only trained to just warn individuals of this withdrawal syndrome, but looking at this zebra approach, if you will, these nutritional deficiencies, we can kind of prevent some of that withdrawal, and then there's also nutrients that can help minimize this withdrawal effect. The bottom line is you still need to go very slow to kind of recalibrate some of the neurochemical changes, but nutritional support can be very helpful for this withdrawal from antidepressants.
Yeah, and so sometimes you would prescribe antidepressants. Is that the case as well?
Yes, absolutely. I'm never, I don't have one tool in my toolbox, if you will. So for someone who's severely depressed, thinking of suicide, the nutritional work that I'm talking about might take 1 to 3 months to take effect. And oftentimes we would use the antidepressants with nutritional support. And there's research looking to support that.
How would a person find someone like yourself? I don't know how many like yourselves there are out there. Is there a website, or do you have links on your own website that would take people to resources?
Yeah, at my website, James Greenblatt, MD, there are links. There are a couple organizations. One is called MMH, Integrative medicine, mental health, and there's a list of providers on that website as well.
Okay, that's great. Anything else in the zebra approach that you'd like to highlight?
Well, one of the, I start the book focusing on nutrition, and I call that, nourishing the brain. And then, end the book with more mind body information on kind of nurturing the mind. And I think that's just as important. And oftentimes we forget. So the role of faith and spirituality, depression. So those individuals that have stronger faith, whether it's an organized religion or not, they respond better to medications and they recover more quickly. So it's a very important kind of part of one, an assessment, and two, in our treatment.
Yeah, I was surprised but gratified to see that you had sections on spirituality and faith and yoga and mindfulness and so on. And and I learned some things too. For example, you were talking about CBT, cognitive behavioral therapy, and some variants of that. One being RCBT, which I had never heard of, which I gather stands for what? Religious cognitive behavior therapy. Is that right?
Correct, yes.
Yeah. So
And again, it's helping those individuals that are more kind of, spiritually oriented, and they can use their faith as part of the kind of changes that need to support them in their recovery.
and for all of these, you kind of point to some that there's some scientific research behind these. So even for the RCBT and some of the other variants of cognitive behavior therapy, you point to those, and that adds
Yeah, I
substance to
think,
your book.
that was the important part of this book. And then there's actually a sister book, a textbook that was written by myself and 30 other physicians. That's I think there are 3,000 references on the similar chapters in this book. So the importance of the scientific information research is really critical to, one, help our colleagues understand the importance of this work.
And it's not just CBT. I would want people to know that you're endorsing here. You actually refer to other therapeutic approaches as well. And and there was an important paper that appeared in the American Psychological, in the APA journal, the American Psychologist. I interviewed the author, and I'm blocking on his name right now, but he did a review of insight-based depth psychoanalytic approaches. Maybe you know the person I'm referring to. I'm really
Not familiar with
embarrassed.
the name, yeah.
Yeah, I'm really embarrassed to forget his name. But I think that was really a key article that a lot of people don't know about, haven't heard of, because uh, the cognitive behavioral approach has been very effective in terms of their PR. And
Yeah.
they're not the only game in town. They're not the only effective game in town. And again, kind of as you've been emphasizing in relation to nutrition and so on, different strokes for different folks. Not everybody's going to respond as well to any given approach, I think.
I think the importance of an individualized both assessment treatment plan is really the core
Yeah.
and the most important point. And one of the reasons I use the zebra as the kind of mnemonic is that zebra has been always fascinating that, each zebra has a unique stripe pattern.
Yeah.
So no two zebras have the same stripe pattern, and that kind of reinforces that sense that everyone's different.
Yeah, that's a good metaphor. And so talk a little bit about some of these other alternatives, for example, yoga, mindfulness.
Well, I think that certainly mindfulness, be it practice for 3 minutes a day or longer periods, we've known, and we have research again, as you alluded to, where it supports and changes brain structure, and so I don't prescribe one particular mindfulness exercise or yoga to everyone. I find it really helpful that people kind of identify what they feel best with, but understanding that the mindfulness being the broad umbrella term, that everything, and there's chapters on kind of blue space, looking at water, green space, being out in nature, all providing neurochemical changes that can support therapy and treatment for depression.
Yeah, you even have a chapter called Beyond Mindfulness. What's beyond mindfulness?
Well, again, that's where we kind of looked at things that we can do, in our life around the environment and being around nature that has effects both for we studies for kids with ADHD as well as depression to be able to help.
Yeah, yeah. Talk to us a bit about probiotics. That's another thing that's very popular, getting a lot of press these days, and it relates to our previous conversation about the gut and the biome. And I think the whole thing about the biome is fascinating. That we have all
Yeah,
these organisms living inside us that are really important to us.
yeah, we have the weight of our, the bacteria in our gut is probably the size of our brain. So we have almost 4 pounds of bacteria that provide lots of support for our health, and the bacteria in our gut actually produce all the neurotransmitters and can affect neurotransmitters in the brain. So we've demonstrated the relationship between the brain and the gut, and the gut and the brain. I think there's been a little, overhyped, like the gluten mania. Probiotics can cure all of mental illness. It's not that good, but there are a number of things we can look at. And some individuals where the gut is the major problem, that there's an overgrowth of bacteria that produce chemicals that we can look at and we can test for that are affecting the neurochemistry in the brain. And if we treat the gut with the probiotics, or sometimes we even need to use antibiotics, then we'll see dramatic shifts in the brain and or symptoms of anxiety or depression.
With so many probiotic products out there, how's one to decide between them?
Very, very difficult. I think that you would need to you don't want to go to a someone who understands probiotics that can help you with understanding which companies are probably have the best quality. I wouldn't just buy a probiotic off the shelf. We use a company called Pure Encapsulations because of their quality. There are other companies that are good, but you just don't want to buy any probiotic.
Yeah. I've been using a website that I'm not sure if you are aware of it or not, a website slash service slash online newsletter called Consumer Lab. It's either Consumer Lab or Consumer Labs. And it's not to be confused with Consumer Reports, but actually they evaluate a lot of the supplements that are out there. They look at the different brands. They check to see what concentrations of the purported ingredients are there or not, and they give big thumbs down to some, big names, but they find that they fall short. That might be a good resource. Are you familiar with that?
Yes, absolutely. And I've seen much of their work. And yeah, there's not the same regulation that we have with pharmaceuticals, but there are a subset of companies that do have the quality assurance is really important to them. And I know that site, and that's a good resource.
Oh, yeah, good. I'm glad to get your endorsement of that. Um, so, as you look down to the road, what do you see in the future for depression?
I see that the integrative approach is really making a headway in academic medicine, which means research is being done. Many academic medical centers have integrative departments. One of the areas of research is on the role of inflammation and depression. So this has become now an academic kind of model where we're understanding that just how inflammation can contribute to depression, um, as well as cancer, heart disease, and other chronic illnesses. So as that research is occurring, both pharmaceuticals are being changed, and then the nutritional and our lifestyle changes that can affect inflammation are being incorporated into treatment. So major academic centers now are doing courses on mindfulness, doing courses on nutrition, and doing courses on yoga. So I'm very excited now that the treatment of depression will be kind of embraced with a more integrative, holistic approach.
Yeah, inflammation is another hot topic. Yeah, I'm glad you brought that up. What are your recommendations for those of us who would like to reduce inflammation in our bodies?
Well, again, like the gluten and the probiotics, there are people that are saying everybody who's depressed has inflammation. And, again, doing this for many, many years, we can look for markers of inflammation and we can see, and some are and some aren't. And if there are markers of inflammation, then we aggressively treat that. We treat that with fish oil and magnesium and mindfulness. If there aren't markers of inflammation, then that's probably not the contributing cause of that person's depression.
Hmm. Hmm. So, what are the biggest challenges that you face right now uh, in your work? Is that something you can talk about?
Sure, I'm actually trying to prepare a lecture with that in mind. So, and I think it's growing, and the clinical challenges, as well as kind of um, other challenges, have to do with one, lots of people that you will talk with or have written books on integrative psychiatry are saying very different things. And how does either a patient or someone learning take that contradictory information?
Mm.
Somebody saying everyone is inflamed and that's the only treatment for depression. Someone else is saying everyone should take St. John's wort. So part of it is people having very strong beliefs in the integrative community about how to treat depression. The second part is you brought up early is the insurance coverage and how to get our health insurance to realize that they might support a $300 or $600 a month medication, but they won't support a $30 a month supplement. And there are individuals who can't afford either 30, 40, or $100 a month for supplements. So the health insurance and financial constraints are another concern.
Oh, yeah, that
And
seems like
and
a big thing. I mean, that would, uh, you know, I think a lot of people would feel liberated to go and and get more involved with an integrative approach if that were covered.
yes, absolutely. And it's both not a cost effective, yeah, because these medications are incredibly expensive, but it's very short-sighted in terms of recovery from the depression.
Yeah. Well, I guess that involves some political work, then, I guess, by the integrative associations to try to persuade lawmakers about the value of the approach.
Yeah, I think the movement is coming from the research now, demonstrating the efficacy, and and then more insurance companies are really appreciating that patients are getting better. One thing that's been utilized more frequently the past 5 years is genetic testing, looking at genetic kind of variables that help predict which medicines might be helpful or which supplements might be helpful. And some of the insurance companies are now looking at that. Um, and they've been very honest with me. They're willing to kind of say, if it's going to help our patients, we want to explore these ideas.
Oh, so you actually have done some dialoguing with insurance companies around these issues?
Yes, yeah. And
Well,
the again, they're kind of wanting to see the research as well as kind of the understanding of one, how it's going to help them save money as well as help their patients.
okay. Well, as we sort of wind down here, I wonder if there's anything else that you'd like to say. that you maybe haven't had a chance to address?
Well, I think the importance of looking at that individualized approach. My interest as a child and adolescent psychiatrist is that if we look at these young 14 to 18-year-old kids with increased rates of depression, increased rates of suicide, the studies are clearly showing medications are not that helpful in this age group. So an integrative approach can provide a huge benefit for these kids that are really struggling. And suicide is something that we don't talk about. Rates are increasing, and effectively treating depression is really the goal. And integrative therapies can be an important part of that equation.
Wow, yes, that opens up a whole other topic area, uh, suicide and depression among young people. Well, I appreciate the opportunity to speak with you again and keep up your pioneering work.
Great. Thank you very much. Nice to see you again.
Okay, thanks for being my guest on Shrink Rap Radio. Bye.
Bye bye.